Improving the nurse's knowledge of the activation criteria of the Rapid Response Team at Maimonides Medical Center. Capstone Project by Anna Roy. Maimonides Center is a 711-bed healthcare center located at the heart of Brooklyn in Borough Park. The 2008 Joint Commission National Patient Safety Goal encourages hospitals to implement systems to enable healthcare staff members to directly request additional assistance from a specially trained individual when the patient's condition appears to worsen. Studies have shown that the greater the number of rapid response calls, the better the patient outcome. Yet today, prompt detection of activation of the rapid response is a patient safety concern. This project is led by the Rapid Response Team to explore the registered nurse's knowledge on the activation criteria of the rapid response at Maimonides. A questionnaire will determine the level of knowledge of these RN, which will guide the Rapid Response Team to develop printed and workshop material for bringing nurses at the required level over a 1-year period. The mission statement of Maimonides is to provide quality care for its patient. Rapid response systems have been shown to improve quality care as they reduce patient mortality on med-surg floors. Studies have shown that the greater number of rapid response calls, the better the patient outcomes. The recommended minimal rate to ensure patient safety is 25 rapid response events per 1,000 discharges. At Maimonides, the rapid response rate was well below average, at 15.3 per 1,000 discharges. The activation criteria are a set of defined values that allow any hospital staff member and patient family to alert the rapid response team for support when a patient is unstable. Being able to recognize the activation criteria of the rapid response event is the first step to its success. The registered nurse is often the one to activate the rapid response. This explains the project objectives to improve the knowledge of the nurses of the activation criteria of the rapid response team. Improving the rapid response activation criteria will increase the number of rapid response events and prevent intensive care admission and mortality, safeguarding the patient. The objective of the project is to have fully informed nurses on the activation criteria of the rapid response team. The project will improve the registered nurses' knowledge on the activation criteria and provide them with accessible material to support their decision to activate the rapid response. We expect a reduction in failure to rescue incidents of 5% over the next 6 months, and 10% increase in the number of rapid response activation over the course of the year, which will be used as proxies for increased knowledge, perceived positive attitude. In consequence, the safety and well-being of all the patients on medical and surgical units will be improved, an objective reflecting the Maimonides mission statement. The first objective will be to carry out a questionnaire and to have 2 focus interviews. The second objective will be to create a poster that you can see in this slide. The last objective will be to present the poster. The target population of the project are the registered nurses at Maimonides. There are around 2,300 nurses, and 30% of them are certified in specialties beyond their degree, have on average 12 years of experience. We differentiate the less experienced nurses from their colleagues, as current studies show that the use of rapid response for unstable patients on medical and surgical floors help improve patient safety, albeit less experienced nurses are less knowledgeable of the activation criteria and fall ill at ease to call for help. Also, on night shift, there are fewer personnel available for counsel in case of patient difficulty. Rapid response events have been associated with a 17 to 23% reduction in mortality rates and cardiac arrest. It is therefore important to improve the knowledge of the activation criteria of the rapid response team for these less experienced nurses. The core of the project is to collect data to measure the level of information of the nurse's knowledge in respect to the activation criteria of the rapid response team, to activate the collected information and to propose corrective actions and supporting material. The main collection vehicles will be a questionnaire and 2 focus interviews. Once the information is collected, it will be processed and analyzed for obtaining the required measures. The appropriate corrective actions will be developed, documented, and delivered to the target population. Throughout this project, we will use Lewin's change theory, which will be used to introduce change within a hospital. It is composed of 3 stages. The first stage is the unfreezing stage, where the project will be informing the nurses of the needs of adaptation. During the second stage, the changing stage, the project will collect information substantiating the importance of knowledge of the activation criteria for a rapid response event, process this information, and deliver a plan for action. The third stage, the refreezing stage, will see that the nurses integrate the information presented throughout the printed material and workshop sessions, thus leading to a stabilized and improved rapid response system. The project will produce 5 deliverables. The first are the results of the questionnaire. From there, a visually attractive poster containing the activation criteria, an information pamphlet explaining the activation criteria, as well as a badge information card containing the activation criteria of the rapid response, will be created accordingly. Lastly, a workshop on the activation criteria and mock code events will be prepared and offered to the nurses on medical and surgical floors at Maimonides. These deliverables are designed to benefit the target population for helping fill the potential knowledge gaps. Like every project, there are exclusions and constraints. The exclusion is that this study will only be carried out on medical and surgical floors and will not include the intensive care units, as they have intensivists, doctors, in the units at all times that manage emergency situations. The two main constraints are time and cost. Time is the main constraint of this project, as it is part of a course lasting a few weeks, while the outcome could benefit Maimonides on the longer term. The second constraint is that the project has no initial sponsoring, and it will require cash for the actual deliverable production. The costs involved in the project are mainly cost accounting figures, as most participants are volunteering and see their involvement as part of their job description. The only foreseen cash outlays are for the volume printing of the produced documents. In conclusion, we can say that the questionnaire revealed that the night less experienced nurses need reinforcement on knowledge of the activation criteria of the rapid response team. The project deliverables are aiming to correct these deficiencies and reinforce the use of rapid response to ensure the patient's safety on medical and surgical floors. These are the references that were used to prepare this slideshow. Thank you very much for your time.